Kearns, and I work at the Northern Regional Bleeding Disorder Center in Traverse City. And today I want to talk to you about cavities. Here are some cavities that we've treated with silver diamine fluoride. Silver diamine fluoride is right here. We call it SDF. And it's a clear liquid that you put on cavities, and it turns them solid black and rock hard. It will travel through the saliva and find other little cavities and turn those black as well if you have any extras. It's good for small and large fillings, and if you don't like the black color, we can always cover over it with a tooth-colored material. Now, silver diamine fluoride has been around for over 80 years. It's really beneficial. Not a lot of offices have it though. We use it quite heavily in public health. But I'll give you some examples of when we like to use it. For small children, it's atraumatic, so it's really beneficial for them if they don't sit in the chair well or handle shots in the drill very well. But also for adults who are skittish of getting fillings, or patients with bleeding disorders who can't have a mandibular block to numb up your mouth. And it's dangerous to do specific restorations or injections. So with a bleeding disorder, see if your dentist carries this silver diamine fluoride. And if they don't, they can easily purchase a little bottle of it and take a little training class on how to use it. But basically, if you have a crown, there is a margin on the crown where you can always get little tiny cavities starting at that lip where the crown meets the tooth. And so if you do start to get a cavity there, instead of taking off the crown and fixing the cavity and putting the crown back on, which is really expensive because now you have to purchase another crown, the easiest thing to do is to put the SDF liquid right there. If you can catch the cavity early enough before it goes up underneath the crown, then you can catch it early enough and it'll turn it dark black and rock hard, and it'll kind of kill it. And then you don't have to worry about it anymore as long as you keep it nice and clean still. And they can reapply the SDF every time you come in for your cleaning. They can do it, or once a year, however often you need to have it done. You want to make sure that you are comfortable with seeing the little bit of black that might be exposed. Usually in the back teeth under a crown, it's not as big of a deal. But when patients have bridges and the bridge fails, that's quite expensive to replace a bridge and just a single crown. So we like to use SDF on things like that. And then for elderly patients who have a lot of root surface exposed on their tooth, the root surface isn't covered by enamel, so it's very susceptible to get cavities. So on root surfaces that are exposed, they tend to get a lot of cavities. And so we put SDF on the root surfaces as a preventive treatment, and it really helps reduce cavities in the elderly population by about 70-some%. So it's really quite effective. So I wanted to draw this to your attention. This is called silver diamine fluoride, and it is non-invasive. It is very safe, super easy to use. And even if you have just a little cavity starting, it's great to plop it on there. It'll take care of the cavity for you, and you don't have to have a large filling. You don't have to get a shot, get the drill, be at risk for a bleed because of the dental work. It's super easy to do, and we do it numerous times a day. Thank you for watching, and I hope you enjoy the rest of your day.